abbreviated my name, ARDS, called ARDS, short for acute respiratory distress syndrome, which is an example of what they said was the serious illness in COVID-19 patients where they couldn't breathe, when in reality it was actually a nervous system paralyzation by venoms. And then you have what's called pneumoconiosis. These are conditions in which you're inhaling something that injures your lungs. For example, black lung disease came from asbestos inhalation or asbestos dust. All right, so for review, lung diseases affecting your air sacs include pneumonia, TB, emphysema, pulmonary edema, acute respiratory distress syndrome, abbreviated Ardis, pneumoconiosis, and then lung diseases that affect the interstitium. The interstitium are these thin, delicate linings between your alveoli sacs. There's tiny little blood vessels that run through them and let gas transfer between the alveoli and your blood. Examples of interstitium diseases is interstitial lung disease. This includes sarcoidosis, idiopathic pulmonary fibrosis, and autoimmune diseases. Also, pneumonia or pulmonary edema can also affect, because they're full of water, can affect the interstitium. Interstitium. Sorry, I was saying that wrong the whole time. Interstitium. All right, then you got the lung diseases that affect the blood vessels in your lungs. Remember, the blood goes out of the lungs back into the heart. Heart pumps it back into the lungs to get oxygen. Lung diseases affecting your blood vessels are pulmonary embolism, that's a blood clot. Pulmonary hypertension, that's an increase in blood pressure inside those pulmonary arteries. Lung diseases that affect the pleura. Pleura is the lining that surrounds your lungs. I don't know if you ever took out a set of lungs. I have, because I've dissected bodies before. But when you take out the lungs, there's this thin coating around your lungs, thin skin called pleura. If that gets inflamed from injury, usually if the pleura sticks to your rib cage or gets injured, trauma gets there and you get an adhesion there, it is super painful. I actually thought I was going to die when I was about 14 years old when I had this happen to me, when I took a deep breath in first thing in the morning after throwing an axe for hours the day before cutting up trees from a tornado that came through our neighborhood. And I was doing that for several days in a row. And then I had pleural, what was called pneumothorax, actually. So lung diseases affecting your pleura is what's called pleural effusion. Fluid collects in the space between your lung and your chest wall. And then pneumothorax is air may get into the space between your chest wall and the lung, collapsing the lung. And that's what had happened to me when I was 14. And then mesothelioma, which y'all have heard about with asbestos poisoning, and drug poisoning. There's certain prescription drugs that have that listed as a side effect. And then there are lung diseases that affect the chest wall. You have obesity, hypoventilation syndrome, which you can just figure out what that is. People that are obese can't breathe. And then neuromuscular disorders, such as ALS or myasthenia gravis, actually reduce the lungs' ability to function, to draw in air and breathe. I'm going to continue here. I'm going to keep going. Sorry, I've got a whole bunch of documents here I'm wanting to reference and not forget. All right, first thing I'm going to talk about is asthma. I know you inhale the asthma drug, albuterol, and then, or a corticosteroid of any kind. I know you inhale that and then it relieves some of your symptoms, but you do not have asthma because you're deficient in a corticosteroid. I know it helps, but that is not why you're sick and why you have asthma. The majority of people that have asthma because they have a heart problem. The heart and the lungs are basically one organ. If the heart's in spasm, the lungs' blood vessels are going to be in spasm, and then the whole lungs are going to go into spasm. This is what we found with my daughter to reverse her asthma that she had since birth. They told us, which it was not from birth. Actually, right after she was born, they injected her because she was 6 months early. They injected her with a drug in the NICU without my permission. And that drug has a side effect to damage heart muscle cells and create a scenario like myocarditis or scarring on the heart. And when the heart struggles from then on out, there's a published side effect of the drug they use to inflate the lungs of newborns in hospitals. When babies are born premature, like my daughter was 6 weeks early, they often will tell you the lungs are the last things to develop. So if they come early, sometimes their lungs aren't fully inflated. You'll know it because the baby will come up and won't be able to breathe, or half the lungs breathing, one lung over the other, and they'll turn purple and they'll rush them off to the NICU to give them a shot of a drug that makes the heart beat harder and faster to inflate the lungs with blood flow. That drug works, but the drug damages heart muscle tissue to cause asthma. And yes, the drug in NICU that they're giving to every child in America born premature, which America has more premature babies than any other country in the world. When that happens and they inject your baby with that drug, it damages the heart as a side effect, and they will have forever, unless you fix it, asthma or upper respiratory problems, reoccurring pneumonia or RSV symptoms, respiratory syncytial virus symptoms, over and over and over in their childhood. And there are products that heal the heart from the damage of this drug to reverse asthma. I have found nothing more powerful at getting rid of asthma attacks than treating the heart. What does the heart typically need? B vitamins, organic B vitamins. What else does the heart need? Things like ubiquinol or CoQ10. It also needs healthy fats like fatty acids. Omega-3s are a great source for the heart. The heart also becomes deficient in copper as a result of the trauma of the drug. So a copper deficiency leads to a weak heart also. So these are some of the things you should consider if you or a loved one have asthma. And then I want to talk about a drug that's been prescribed since Obama was in office. It's called Symbicort. Symbicort is a combination drug inhaler for asthmatics. And if you know anybody who's on Symbicort, you should know it is published that that inhaler is 2 different asthma drugs. One is abbreviated a LABA, L-A-B-A. Do you know that LABAs, from the time they introduced Symbicort, is published? LABAs, before Symbicort came out, did you know LABAs were banned in the United States for causing death to asthmatics? Do you know that Symbicort is 2 drugs and one of them is LABAs? They figured out a way to how to put it back in circulation. Why would they do that? Well, when they released Symbicort during the Obama's administration, like in 2008, when they actually put it into the media and put it in magazines to promote it, there was actually they actually had this warning. It actually used to say this right at the top underneath Symbicort. What's the most important thing people need to know about Symbicort? Number 1, Symbicort has a drug inside of it called a LABA, and LABAs have an increased risk of causing death caused from asthma. So this drug LABAs increase the risk of death from an asthma attack. And it's proven to do that, which is why that drug was banned decades earlier from when it was put into Symbicort, and now you're inhaling. So you do not have a Symbicort deficiency that is not causing asthma. And I don't know why in the world anybody, once they knew, they would continue to give their child Symbicort, their mom Symbicort, their aerobics instructor Symbicort. Why would you ever let them take that drug? It actually has a published side effect to increase your risk of death caused by an asthma attack. It's in their documents. Go look it up if you want to. All right, so get off of that. All right, did you also know that copper deficiency is also implicated in COPD disease, or chronic obstructive pulmonary disease? Yes, it is. And yes, you should supplement copper. What kind of copper? I would go to globalhealing.com and use their bioactive copper is what I would do. That's just an example. All right, so we're going to keep going. I'm not done. All right, let's keep going. All right, now what are some essential oils, for example, that are proven beneficial to help combat all health lung conditions or health conditions related to your lungs? Well, I'm going to run through these because it's very, very exciting. Did you know that there's a plant called the eucalyptus tree, and that it has an oil called eucalyptus oil that has been proven to actually rid the lungs of microbes like bacteria, fungi that cause respiratory illnesses, which are implicated in all 4 of the major diseases I just mentioned related to the lungs? It's also used widely for centuries around the world. They have found that eucalyptus oil, has been beneficial long-term therapy for asthma control and COPD. Bet you didn't know that. They also found that in a study, 200 people with acute bronchitis, they treated with oral doses of cineol, which is in eucalyptus oil, and they saw significant improvements in simply 4 days after giving it to them. This is acute bronchitis patients. Speaks to how powerful eucalyptus oil can be. What other oils have they found are beneficial to reverse asthma and all lung conditions? Lavender oil. In fact, they did a study with mice with lavender oil and found that lavender oil suppresses inflammation of mucus in the respiratory system. So wet, productive coughs, pneumonia, you name it. If you're coughing up mucus, that is a wet, productive cough. Lavender oil has been proven to help with bronchial asthma also and reduce mucus in the lungs, which would make it great for COPD as well. Sweet orange oil is another one that has been found to actually reduce expectorant in COPD patients and to calm anxiety. Bergamot, spelled Bergamot oil, has also been found and is very popular at reducing and soothing the nervous system and lung symptoms related to infections and COPD flare-ups. And then we get to the ones Jesus was brought himself as a baby, frankincense and myrrh. Did you know that these two demonstrate anti-inflammatory effects, and they have also been shown in studies to actually reverse COPD symptoms, and that they might work to improve or reverse asthma, RSV, and TB. This is the power of frankincense and myrrh. So these are just examples of some of the essential oils that you can consider that God put on this earth that you could apply to the chest, diffuse in your home, or put on the body, anywhere on the body. But diffusing would be really great because you're breathing it right into the lungs. These are some of the basic things you can do to help improve and prevent worse outcomes in lung diseases. We'll be right back after.